task as big as childhood immunization in a city of almost 260,000 people, there's only one way to get the job done. Teamwork. People pulling together from every corner of every neighborhood and every income group, young and old, professional experts, and caring citizens. These are the people who accomplished this mission in Norfolk, Virginia, where the immunization rate was just 48% for children under 2. That is less than half of Norfolk's children. To solve this problem, the Centers for Disease Control funded a project called CINCH, which stands for the Consortium for the Immunization of Norfolk's Children, and is coordinated by the Center for Pediatric Research, a joint program of Children's Hospital of the King's Daughters and Eastern Virginia Medical School. But it was the people who supplied the heart. The goal of CINCH has been to increase childhood immunization to 90% by the year 2000. To accomplish this, CINCH began in 1993 with a handful of staff who initially organized a 35-member community-based coalition. Through phone calls, networking, and persistence, CINCH mobilized a group that included parents, healthcare providers, social services, churches, schools, military, community groups, and more. And they organized themselves into 3 working groups and a steering committee. From the project's earliest stages, the coalition has been successful because it made good use of each member and each member's connections to others. Much more than just an advisory committee, the members are the lifeblood of the project. Both highly educated professionals and concerned parents and volunteers have an equal voice. As a group, they identified what needed to be done, who should do it, and how it would best be accomplished.
CINCH has become synonymous with collaboration. We've been able to accomplish what we have in the community because of the participation of everyone, not just staff or a few leaders. Without community-based support, CINCH would not have been successful.
The coalition's first job was research. Before they could suggest a solution, the members had to identify why more kids weren't being immunized. So they embarked on an extensive needs assessment. They looked at existing data and relied on the expertise of coalition members to create and conduct surveys and focus groups to gather new facts. All coalition members were involved in the process, in whatever way made best use of their talents.
The Center for Pediatric Research worked closely with CINCH members to design and conduct a community-wide survey of Norfolk children. This provided CINCH with highly reliable data to know the immunization coverage levels and the reasons why Norfolk children might not be getting their immunizations on time. Personally, I found it wonderful to see how CINCH members were able to be part of the survey and to use the data for effective community planning and action.
One coalition member designed a survey for physicians. A house-to-house survey was also conducted. Members from the city planning staff plotted medical providers' offices on city maps. A member from Norfolk's Old Dominion University conducted 6 parent focus groups. Through this 6-month assessment, CINCH members learned why Norfolk's immunization rate was below 50% for children under 2. The research pointed out specific barriers to immunization. These findings led to the next phase of the project, developing a plan to address these barriers. But first, the members had to learn how to plan. Because while everyone on the team brought a concern for children, not all knew how to turn need into action. So CINCH staff taught them in 2-hour planning workshops. And then the group put its newfound knowledge to work. Over the next 3 months, the work groups and steering committee methodically developed a plan to attack the problem of under-immunization. With guidance from staff, a democratic process that gave each member an equal voice, and a lot of hard work, the groups established goals and objectives, and identified 28 intervention strategies to turn problems into solutions. The most important part of each strategy was how it made use of resources.
Our public awareness work group was able to get such good coverage because we used every possible resource.
When you have a great product, it's an easy sell to get the media to do stories. We were everywhere, on all the TV stations and in the newspapers. We were also able to get reduced advertising rates on billboards and bus cards because the entire community saw the value in this project.
To get the word out, volunteers from community organizations, such as the March of Dimes and Junior League, staffed information booths at various events. A poster contest got children involved in the mission. And the Norfolk Alumni Chapter of Delta Sigma Theta Sorority helped educate mothers at a community WIC clinic. Coalition members offered time, caring hearts, and the support of their organization. In fact, connections to other people were some of the most valuable assets the coalition members contributed. Because each one represented a constituency, the power of the coalition was really the power of many hundreds of people, not just the 55 or so individuals who got together for meetings.
2 members of Norfolk Alumni Chapter of Delta Sigma Theta Sorority attend CINCH meetings. However, about 25 of our members have participated in clinics as well as other CINCH activities. We have all found these experiences to be very rewarding, as well as meeting our goal of community service.
Making such good use of volunteers was essential to CINCH's success, because the project's funding from the CDC only covered administrative costs and research. Resources to achieve all the strategies had to be donated or raised by CINCH member organizations. And time after time, they came through. The health department donated printing for thousands of flyers. McDonald's donated drinks and food coupons as incentives at various events. And Children's Hospital of the King's Daughters donated funds and allowed CINCH to use its Children's Healthline phone number on all printed materials. So, by harvesting every resource, CINCH broadcast the importance of immunizations to thousands of families. But all the publicity in the world won't do any good if people can't get to where the immunizations are given. So the second work group's mission was to improve access to immunization services.
The committee came up with many strategies to achieve their goals. We even hired a community outreach coordinator. It was a real democratic process.
The group tapped the resources of its members to make immunizations more accessible.
One member contacted the city's public transit service, enabling CINCH to buy thousands of discounted bus tickets, which were then distributed free to families. The coalition involved Norfolk's Bicycle and Foot Patrol Police, asking them to hand out wallet-sized shot schedules in the communities they patrolled. Community businesses and churches did their part by distributing flyers.
It wasn't very difficult to get churches involved. In fact, we contacted the Ministers' Conference, and we got some 5,000 flyers distributed.
Throughout the 3-year process, the coalition constantly looked for new members to help solve problems. Whenever the group had a need, it evaluated who could best get the job done. And if those people weren't already involved, they were invited to join. In this way, CINCH was dynamic, constantly growing and changing. And in the end, it all added up to community empowerment, helping families help themselves to better health.
When I first came to CINCH, I came with very little experience, and I was concerned that others might not listen to me, but they did, and it's been a very rewarding experience since.
The third work group's mission was educating healthcare providers. This objective came directly from the initial research, which had shown that health providers sometimes missed the opportunity to immunize. So CINCH set out to improve physicians' knowledge of the problem, starting with its own coalition members.
The nicest thing about being a CINCH member has been the diversity of the group. We have community leaders, healthcare providers, and concerned parents who all have an equal voice. We all learnt from each other, and it was a mutually beneficial experience.
To enlighten healthcare providers about the latest immunization information, CINCH conducted workshops and used a graduate student to visit physicians and distribute packets. The health department worked with the social services department, reviewing immunization records and sending out reminder notices to parents.
And a Kiwanis member got her club involved by donating an $100, which generates phone calls to parents, reminding them about well-baby visits and immunizations.
The Kiwanis got involved with CINCH because immunizations are important, of course, and because this group really seemed to know how to get things done. It's always nice to be associated with a winner.
In a continuing effort, CINCH is working with Children's Hospital of the King's Daughters, the Norfolk Health Department, and local pediatricians to conduct semi-annual case assessments and establish a computerized tracking system to help parents and providers keep track of children's immunization records. The group even initiated a legislative bill to allow greater sharing of immunization information among healthcare providers. After 3 years, CINCH has definitely made an impact in Norfolk. Thorough research and assessment, careful planning, active community involvement, the participation of professionals, and creative use of volunteers are all reasons CINCH made a difference. Those who got involved, from the physicians to the community volunteers, said the vision of the leadership and the quality of the process were what kept them interested, and why the group is still together today, beyond the funding period, tackling new health issues that affect the community.
CINCH makes a difference because it's a true collaboration among people united for a common goal. We work side by side, bringing together our resources, listening to each other, not letting titles or roles get in the way. You don't find a community-based participation like this everywhere.
Of course, the real winners are Norfolk's children, the thousands of families who became aware of the importance of immunizations and who have greater access to them. This community enlightenment and improvement in service delivery was CINCH's goal. And by building a group that worked together and used volunteer resources so well, they are on the way to achieving that goal.
The thing that was so inspiring was the large variety of people involved.
It was a real team effort.
It was great to see our contributions make a difference and actually reach the people we were setting out to help.
It was a really unique experience with all the disciplines meeting and planning out a strategy. I certainly enjoyed it.
A lot of times people don't want to listen to a person who's older, but this group really valued what I had to say.
Changing an entire population's understanding about childhood disease and health wasn't a cinch, but it was possible, and the process can and should be duplicated in other communities. It takes vision and collaboration and hard work. But it's worth it, because what your community stands to gain is immeasurable.